Right. Hello, good morning. My name is Farhan. So this morning, I will talk about iliotibial band friction syndrome. So what is actually is a ITBS? It's a common overuse injury presenting as a pain at the particular region on the lateral femoral condyle. So it normally occurs after the repetitive movement of the knee, such as for the athlete, runners, cyclists, and also the endurance marathon athletes. So we talk a bit about the anatomy. ITB itself is a thick band in the lateral part of the human leg. It was formed by the combination of the three components. It is gluteal maximus and gluteal medius, and also the tensor fascia lata. It was origin from the anterolateral iliac tubercle at the iliac crest, and then inserted at the Geddes tubercle of the lateral tibial plateau. ITB itself is innervated by nerve shed together with the gluteal maximus and also tensor fascia lata. So the nerve supply for the ITB is got two: superior gluteal nerve and also the inferior gluteal nerve. So what is the actually function of the ITB? It's act as a hip extension and also hip abduction and also the lateral hip rotation for the proximal. For the distally part is for the active knee extension and also active knee flexion. So ITBS etiology is some literature said is a repetitive movement of the knee extension and flexion. But however, biomechanical study found others factors such as plane motion may be more fluent. So for example, tibial internal rotation can augment compression of the forces around the lateral femoral condyle by moving the ITB's distal attachment to the tibial more medially. So what is the risk factor for the ITBS? There is a lot of risk factor, such as the increased tibial internal rotation itself, weak hip abductor muscles, tight iliotibial band, and low hamstring strength, and also what you call the stretching. Other than that, it can be because of the genu recurvatum and also increased landing forces during the activity. Commonly, patient will come to us in the clinic with pain and also sometimes associated with swelling and also crepitation on the lateral part of the knee. So usually pain will develop after they going for the same distance. That means per day, if the athlete was going for the running after the 100 meter or 200 meter or jogging for more than 10 kilometer, the pain will come at the same distance. So other than that, suddenly change the training session longer or going down the hill also can be aggravated. Aggravated the pain. So tenderness usually elicit at the lateral femoral condyle. It can be associated with crepitus and also the swelling. Sometimes we can do the examination when we ask the patient to do the flexion extension movement of the knee. The other test we can do is Ober test, which is this one to elicit or to assess the ITB tightness. The other, for the supportive clinical diagnosis, we can do also for the ultrasound and also MRI. But so far, the clinical part, from the clinical part only, we can establish the diagnosis. If the ultrasound and MRI, we can also see the thickness of the ITB itself, and sometimes we can also see some collection inside the ITB. So what is the treatment for the ITB? Principally, treatment should be addressed not only for the local symptoms, but also correct the foot and hip biomechanics for more favorable long-term results. So other the symptom fact distally, but the treatment should be more focused from the proximally. So there is various treatment can be done we can divide it into two, which is surgically and non-surgical. That means non-surgical is conservative. We go for the conservative first. The first one, we settle for the part, pain and also swelling. If patient came with swelling, we ask the patient to do the icing. Or maybe we can also ask the patient to do the electrotherapy. For the pain, we can prescribe painkiller analgesic such as Voltaren or Celebrex if no contraindication. Other than that, injection also can be performed, such as the corticosteroid. It's the purpose is to reduce the pain and also to facilitate patient to going for the rehabilitation program. Okay. The other than that is dry needling. Dry needling is to reduce the tension and also to reduce the tightness of the ITB itself. Routinely ITB stretching and also strengthening, and then the strengthening part for the hip external rotator and also abductor muscle also is important. So if all the conservative management is failed, we maybe can refer to the sports surgeon to do the ITB release for the surgery. Okay. So I think that's all. Right. Thank you.